Serotonin antidepressants, step aside, there's a new kid in town. The FDA just approved a new depression medication that I think will be revolutionary. It's not mushrooms yet, but we're close, or we're getting close. I'm Dr. Tracy Marks, a psychiatrist, and I make mental health education videos. Neuroplasticity is the idea that for optimal brain function, it depends on the connections in the brain's nerve circuitry. And the brain has the capacity to modify those connections. So if we know that altered connections cause depression, why are we still using serotonin elevating medications? Because the downstream effect of those altered connections is that the nerves release less serotonin. So increasing your serotonin levels is still helpful, but it's really putting a Band-Aid over a wound. It doesn't address the upstream bad circuit problem. We also know that the antidepressants that we have work well for some, but there's a lot of people who don't respond to them, and many people have a lot of side effects that make the drugs hard to take. So researchers have been working hard and fast on medications that treat depression, but by a different mechanism and not just increasing serotonin. So here we have the new drug, Auvelity. Auvelity is a combination of dextromethorphan and bupropion. Dextromethorphan is an over-the-counter cough suppressant that is sometimes called DXM and has been sold under the brand name Robitussin. Bupropion is a dopamine and norepinephrine enhancing antidepressant sold under the brand name Wellbutrin. The presence of bupropion is not what treats your depression. It may help a little, but it's the cough suppressant that does the heavy lifting. Bupropion is there to increase how long DXM hangs around. Without bupropion, the dextromethorphan would wear off very quickly. Here's how the cough medicine helps depression. Dextromethorphan is an NMDA receptor blocker. Neuroplasticity relies on the NMDA receptors because these receptors rewire nerve circuits. So here we have a drug that works upstream at the wiring level. Still, how does this help with depression? I've talked in a previous video about the default mode network of your brain and how it's responsible for getting you stuck on negative thoughts. This network is a series of structures in your brain that gives you things to think about when your mind wanders and you're not intentionally thinking about something. It fills in the empty airspace for you, usually with something negative. When you are depressed,